we think about where we're heading in the pandemic, we do expect to see future surges of cases. We do expect cases and hospitalizations even to go up at times in the future. And when we think ahead, what does that look like? That could be the emergence of a new variant. It could be schools reopening in the fall. We have seen surges of cases around school reopening in the past. It could be around colder weather in the winter. So we're looking at this as really being a phased approach to the pandemic, because as you know, we have the BA.2 subvariant that we are closely monitoring.
We'll talk a little bit more about BA.2.
So what we're seeing overall is that it does appear to be more transmissible. So it appears to be about 30% more transmissible than the original strain of Omicron, which, as you know, was more transmissible than Delta, which was more transmissible than Alpha. So these variants have become more transmissible as time has gone on, which is concerning. However, there is some good news, and that is that BA.2 does not appear to cause more severe cases. So cases are not more severe than what we saw with Omicron. And there does appear to be some cross protection in terms of immunity. So people who very recently had Omicron infections, they may be protected from some of those severe outcomes. And then, of course, the vaccines still work, meaning that the vaccines are still protective against severe outcomes and death, which I think is really, really important.
Well, you talk about transmissibility. We've seen the governor's husband tested positive, the lieutenant governor, earlier this year. And then the mayor of Detroit, Mayor Duggan, said he tested positive. It seems, is that what everybody's going to get this? How about you? How are you doing? You know, what are we doing with all of this? Is it our turn? Everybody's going to catch this thing at some point?
When we look at this pandemic and at the virus is not going away. I think that there was some early hope and some early speculation that maybe this is something that could be eradicated. We would be done with the pandemic and we could go on with our normal lives. And this has become apparent that this is not true, that COVID-19 and that the SARS-CoV-2 virus is not going anywhere. It's going to remain with us. And that means we have to find ways to live with it. And what that really means is that every one of us is at risk for contracting COVID-19 at some point. Now, what we want to prevent are the severe outcomes. We want to prevent severe cases. We don't want people to end up in the hospital, in the ICU, on ventilators, and we don't want people to die. And so the best way to make sure those things don't happen are to use the tools that we have. And the best tool are vaccines. So if you're vaccinated, your risk of having a severe outcome, your risk of ending up on a ventilator or dying from COVID are significantly reduced. Then we've got tools like therapeutics. We've got oral antivirals. We've got monoclonal antibodies that can also be used to reduce the risk of severe outcomes. And we also want to prevent, as a society, these big surges of cases where everyone's getting sick at the same time and where our health systems and our infrastructure are getting overwhelmed.
We're also looking at that push for that second booster. How does that fit into all of this?
Well, again, vaccines are one of the most important tools that we have. We really have to use all of these tools in a very holistic approach and use them together. So you are safest if you are using our what we call non-pharmaceutical interventions, meaning you're avoiding very large, very crowded gatherings. You're doing what you can to prevent getting exposed to the disease as much as you can. And then also you are making sure you're vaccinated and boosted, so up to date with vaccinations, that you've spoken to your doctor, that you have a plan for whether or not you'd be eligible for one of these COVID therapeutics, and then making sure that you've got some of these tools at home. So making sure that you've got masks and hand sanitizer on hand for future surges, making sure that you've got over-the-counter tests on hand so that you can use those over-the-counter tests if you become symptomatic, if you've been exposed to someone with COVID, or before attending a large gathering. So making sure that people have all of these tools at their disposal is really one of the keys to moving forward.
Well, with the testing, I've heard some people that they'll have false negatives. They think they don't have it, and it turns out they do. How is testing now? Is it getting better? Is it, where are we with all of that?
Well, in terms of testing, there are two main types of tests. There are PCR tests, and that's looking for the genetic material in the virus at very, very small amounts. And those are incredibly sensitive tests, and they can pick up illness early on, but they can actually remain positive for some time. And then we've got antigen tests, which are like those home tests, and those are not as sensitive. It is possible early in the disease to get a false negative, but there are some strategies that we can use to make those tests more effective. So number one, you can repeat a test. So if you have an antigen test at home, an over-the-counter antigen test, if you take a test and you are negative, you can repeat that test the next day, and that increases the sensitivity of the test. We also advise, if you are symptomatic, if you are unwell, regardless of your test result, that's not really a good time to be going out into public. So if you're unwell, if you have a fever and you're sneezing and coughing, stay home. Stay home and avoid exposing others to whatever it is you have, whether it's COVID-19 or influenza or anything else.
You know, a federal judge just recently, very recently, kind of lifted this mask mandate on airplanes and transportation. What about that? What do you think? Will you still be wearing your mask on a plane now?
You know, we have been saying for some time now that we're in a phase of the pandemic where making these sorts of decisions are really up to individuals. So we now have access to well-fitting, high-quality masks that can protect the wearer. In the beginning, when we were talking about cloth masks and masks that were not well-fitting, really everyone had to wear a mask in order to prevent spread from happening. But now, if you are wearing a really high-quality, well-fitting, multi-layered mask, you can provide protection to yourself. And so people need to make decisions that work for them. So we still recommend wearing a mask if you are unwell, if you've tested positive, if you are quarantining, for example. So there are still some times where we would recommend masking. If you're in a high risk congregate setting, so if you're in a healthcare setting or a long-term care facility, that's another time to mask up. And then we also want people to comply with local and federal rules. So if there are any laws, mandates, rules around masking in the place you're going to, it's important to comply with those rules. But overall, people can now make decisions that work for them. And there are lots of different reasons why people may want to continue wearing a mask. So number one, you may have young children who aren't eligible for the vaccine yet. You may be immunocompromised yourself. Someone in your family may be immunocompromised. You may be wearing a mask for them. And then there's also just wearing a mask to be considerate to others. You don't know who's around you. You don't know if there are people who are very vulnerable who are sitting next to you. And so you may wear a mask for them and for their comfort. And so when you ask if I will continue wearing a mask, I do generally wear masks when I'm in public, when I'm in especially indoor public settings. But again, it's a personal decision that I make with my family and do what's best in for us. And people have to make those decisions for themselves as well.
Yeah, you mentioned your family, children. How are schools doing in dealing with all of this these days?
I think it has been a very hard 2 years for schools. I think schools have been put at the front line of this pandemic, and really they want to get back to the business of educating our kids, which is their primary goal. But they also need to be able to stay open and make sure that kids are healthy enough to be able to stay in school. And that does mean preventing outbreaks. And when I talk about those tools, and I mentioned that vaccines are one of the most important tools that we have, we see that vaccines have not been utilized to the degree we would want them to be in our younger age groups. So when we look at overall vaccination, we're at above 60% for vaccine uptake across the state. But when we look at our younger age groups, when we look at our pediatric population, the 5 to 11 population, that's lower. That's at about 28% statewide. And then when we look at certain communities, that rate, especially in children, drops even lower. And when we look at communities of color, again, we're seeing lower vaccine uptake. And that matters because we are expecting future surges of cases. And we need to make sure that everyone and all communities across the state are protected. So if we don't have vaccine uptake in that younger age group, we could be seeing school closures again in the fall, school closures into next year and even beyond. We could be seeing outbreaks in schools. And then, of course, we know that children who are exposed and transmitting in school settings, for example, can bring those infections back to their family members and to vulnerable grandparents or younger siblings. So we really need to make sure that vaccine rates are up across the board, because if we are not all protected, if we have vulnerable individual vulnerable communities among us, then as a state, we're not going to be able to move out of this pandemic.
It always seems like when we look forward, we're looking back, and we've done a story or two about the long COVID, the long haulers, and I'm wondering how you as a health professional are thinking we're accommodating that problem with so many people.
Well, there's a lot more study and a lot more information that we still need on the long-term effects of COVID. When we think about the virus has only been known to us for 2 years. And so we don't really know what the long-term consequences of COVID-19 are. How does this affect people 5 years after infection or 10 years after infection? And we don't really have the answers to those questions. So we'll learn more as time goes on. But really making sure that as many people as possible are vaccinated and have that level of protection, I think minimizes some of those problems and risks that we're concerned about from things like long COVID.